Good evening. My name is Tammy Belton Davis, and I serve as the Chief Diversity Officer with Milwaukee Rep. Welcome to Let's Talk Vaccinations, a conversation on COVID-19. We are pleased that you have joined us for this important conversation. Our lives significantly changed in 2020 with the arrival of COVID-19, the coronavirus, to our shores. Compounding this global health pandemic has been the pandemic of systemic racism and the issues of health inequity. Black, Indigenous, people of color, BIPOC communities in our country are being disproportionately affected by COVID-19 and the social and economic impacts caused by the pandemic. Many see public health as a necessity for delivering COVID-19 vaccinations as quickly as possible in a fair and equitable manner. It is a moral imperative to address a long-standing and historical distrust BIPOC communities have had for public health policies in general and vaccinations in particular. Public health organizations, community groups, municipalities, foundations, health systems, and others have been leading the way to share the importance of vaccinations while concurrently managing the legitimate concerns from those communities who have hesitancy. This panel discussion is a demonstration of Milwaukee Rep's commitment to being the change we wish to see inside and outside of our walls by raising issues that impact our community. Prior to tonight's discussion, we've hosted listening sessions with community partners and members of the BIPOC community, and we've heard some themes that have prevailed as part of those conversations. There is a desire for clear information and truth. It's difficult to sort through all of the media and current distrust of media. What is the impact of the vaccine on the Black community and other communities of color? What are the adverse effects of this vaccine, the various vaccines, and questions about the variants? There is some good news for those advocating for vaccination. Wisconsin ranks #1 in the nation for vaccinations with now over 1 million individuals fully vaccinated. Governor Evers announced yesterday that starting April 5th, all Wisconsin residents age 16 and older will be eligible to receive a COVID-19 vaccine. Further, Milwaukee County, under the leadership of County Executive David Crowley, have prioritized vaccine accessibility by targeting key zip codes representing communities of color and have stood up additional vaccination sites in those areas. So we're excited that you have joined us tonight for this very important conversation. To our partners in the theater industry and those who are hailing from communities both near and far, we welcome you to this discussion tonight. Again, welcome to Let's Talk Vaccinations, a conversation on COVID-19. So I want to welcome our esteemed panel of health and community leaders to guide us and to discuss this afternoon. Dr. Ivor Benjamin, who is the director and professor of the Cardiovascular Center with the Medical College of Wisconsin, and also a member of our board of trustees. Dr. Benjamin, welcome. Andres Gonzalez, who serves as the Vice President and Chief Diversity Officer with Froedtert Health and also a member of Milwaukee Rep's Board of Trustees. Welcome tonight. Paula Pennebaker, retired. I think she's retired, but former president and CEO of the YWCA Southeastern Wisconsin and an esteemed leader and community member. Welcome tonight. And Erica Sinclair, the founder and CEO of Health Connections, Inc. Let's welcome all of our panelists tonight. Thank you so much for being here for this important conversation. So why don't we get started with both you introducing yourself to our audience and also sharing your vaccination story. So I'm going to start in the order that you came on. Dr. Benjamin, if you will kick us off tonight and let us know a little bit of who you are and your vaccination story. And you are on mute, sir.
Thank you so very much, Tammy. Let me just say how enormously privileged and humbled I am to be part of this august group I salute your leadership, Tammy, and all the efforts of the Milwaukee Rep. Without dwelling more about my own service on the Milwaukee Reps board, I feel that my most important role tonight is to speak with you as a medical provider. I care for patients with COVID. As a result of that, I was one of the first to receive the vaccine within the first week that it was available. But perhaps, and I will yield to the other members of this group, perhaps the most important reason that I would like to be here and to be part of this conversation is not necessarily for the person who's already gotten a vaccine or the person who is just biting at the chops to get the vaccine. I really want to talk with any of you who probably may not get that vaccine. I know what it means to meet people where they are, and I would love to be part of the conversation in getting you to receive this vaccine that I think is life saving. So, once again, Tammy, delighted to be here.
Thank you, Dr. Benjamin. We appreciate you. Andres.
Absolutely. So I will echo a couple of the same sentiments as Dr. Benjamin. Thank you so much, Tammy, and kudos to the Milwaukee Rep for hosting Let's Talk Vaccinations. This is an important topic and critical, right? Discussion. This might be certainly our civil rights issue of this particular decade, if not century, perhaps. So delighted to be here. I am humbled and honored to be the Vice President and Chief Diversity Officer for Froedtert Health. We are known in the community as Froedtert and the Medical College of Wisconsin. That's actually our clinical brand in this community. And certainly looking forward to our discussion today. I will tell you my vaccination story is fairly simple. I unfortunately contracted COVID back in August. I am counting my blessings. I was one of those fortunate individuals that, because of my age and a good immune system, I honestly experienced very mild symptoms. But just the thought that I could actually spread it to my 82-year-old dad who has advanced dementia, who lives with us, or actually my youngest son who actually has chronic asthma, certainly was heart-wrenching for us. And so I think it really provided kind of a watershed moment for me and for us as a family. And so luckily no one acquired the virus from me. My wife actually did an excellent job of sanitizing our home constantly. And she actually, certainly I was completely isolated from everyone here. Fortunately, I had the ability to do that in our home. I know that that's not the reality for many of our community members, but I was fortunate to be able to do that. And certainly just to make sure that I limited my contact with the family. But that was my story, and certainly happy to weigh in today. And hopefully, as Dr. Ivor Benjamin mentioned, perhaps this would actually serve as a little bit of an educational piece, maybe a little bit of a call to action for those who might be on the sidelines, right? Still considering, should I get vaccinated or not? And so hopefully, if you're here today, we're hoping that as a panel, we'll be able to drive those key messages, maybe provide a little bit of that education, maybe booster for you to really consider getting vaccinated. So thank you for having us, and thank you for having me as part of this panel.
Absolutely. Thank you so much. We appreciate it. Paula. And you are on mute.
Darn mute button. It's really great to be here tonight. Tammy, I appreciate the invitation, and I really appreciate the rep for making this opportunity available. I have had the vaccination, and I'm really glad for it. I've always known I was someone who was social and liked to be out and about and meeting people and having conversations about the issues of the day. And I found this period of isolation to be terribly, terribly hard for me. And I really was looking forward to the vaccine. I I don't want to be careless now. I still plan to follow all of the health protocols, but I can't impress upon those of you who are watching today and others who may be on the fence about whether or not to do it. Certainly that is your prerogative, and this is something that everybody has to make a decision about for themselves. And I don't think it helps to tell people that they have to do it. But from personal experience, I will tell anyone who has had the concerns that I had during 2020, the feeling of isolation, the inability to go as I wanted to be in places and spaces with people that I love and care about. If that's what it was like for you in 2020, I want you to know, as one who has had the vaccine, that I feel, my weight lighter after having done it. So I'm happy to be here to talk about it, to explore the historical story and the perspective that people have that underlies the fears, especially people in the African American community, about the problem. Actually, all members of the BIPOC population, we all have a story to tell about experiences of people in our groups with the medical profession. And so I'm just really happy to be here, and I'm very happy that the rep offered this to the community, and happy to see you in your role, Tammy. You're a great asset, I'm sure.
Thank you, Paula. Appreciate you. Erica.
Hi, my name is Erica Sinclair, founder and CEO of Health Connections Incorporated. I started my own medical clinic so that we can actually help dispel some of the issues that people have with healthcare, accessing healthcare, making sure they understood how healthcare works. And so that just follows right up with Paula quite perfectly. That yes, I wanted to be a person that was a trusted messenger of how healthcare should work and can work, and I didn't want to just be a messenger. I wanted to actually be a person that could facilitate the delivery of healthcare. So I am, as a CEO and founder, I employ actual medical providers that deliver the care, primarily for primary care, HIV, and transgender health. So we have the vulnerable of the vulnerable, as our patient population, and the ones that really do not trust healthcare a lot. So we do our best to get them to trust us again. And COVID has actually offered an opportunity for all of us to help get people back into healthcare and to trust it again. So that's why I, in my role as someone who has been born and raised in Milwaukee, has been background in healthcare in national public health, worked at CDC, did emergency response, preparedness, infectious disease, all kinds of things that really, to me, poised me for this moment. And to be able to do it at home means a lot to me. Because this is truly my family, and it's truly a way for me to give back to the community that helped raise me. And so when I do this work, I do it with my whole heart, and I lead with my heart, but also with all the understanding of how clinical systems work and don't work, how healthcare works, public health, all those different things. I am a vice president of the City of Milwaukee Board of Health. I am a consultant within all things COVID, actually testing and vaccinations for the state of Wisconsin and for Milwaukee County. So I am really in this in a way where, and we also do set up vaccine clinics, and we started the first homebound vaccination program that's in Milwaukee. So we have done a lot, and we've done it quite organically, but really quite naturally based on what we do. I did get the vaccine as well, and I too allow people to have a space to ask questions and such regarding the vaccine. I do not manipulate and strong arm anyone to do anything, but I do offer them choices. And that's what we naturally do in our clinic anyways, is we offer people choices. And so when I got the vaccine for Pfizer, I always knew I was going to get the vaccine. I was very happy to get it, very privileged, felt privileged to get it because I knew what it took for it to happen. Both the creation of it and the dissemination of it. And also wanted to make sure that people that I influence around me understood that it'll be okay. There was a bunch of people that were like, "You go first." And I was like, "Sure, I'll go first." And just, I trusted enough to go first. And if that's what it takes for you to make a decision to take this, especially for those that are no longer with us, I take this in honor of them because they didn't have the chance to take it. And this is an obligation, as far as I'm concerned, for me, to the community, and in my version of protecting and helping others have a way of protecting. So
Thank you, Erica. We appreciate it. Thank you for being here. Just so our audience knows kind of the format for tonight, we're going to encourage you, if you've got questions, shout outs, remarks that you want to share as part of this discussion, please don't hesitate to hit the chat to be included in this conversation. We're going to spend some time with our panelists now, and then we will allow for responses to a few questions towards the end of the discussion today. So are we ready to get into it? Erica, I feel like you set us up real good for some of the questions that we are going to tackle tonight. So let's get into it. We're talking vaccinations. Dr. Benjamin, you and Andres both lifted, and all of you in different ways lifted the issues around hesitancy. So can we talk about why there is vaccine hesitancy, particularly in the BIPOC community? And I'll ask whoever wants to start that conversation, we can.
I would say Andres go first.
Wonderful. So I will kick us off here. And certainly I think any one of us could actually answer that question. But, let me just frame the conversation by saying that, about a year ago, actually March of last year, right, when we saw, and you addressed this, Tammy, in your opening remarks, when we knew that certainly the U.S. will be hit, right, like a tsunami with COVID-19, I remember having a discussion with Kathy Jacobson, our CEO, who actually chairs our diversity council, around what our call to action should be. And certainly, right, with the understanding of the role that healthcare has played in America, right? And we certainly can go back to certainly the early 1900s, the Tuskegee experiment, right? And we know how devastating and how heart-wrenching that particular experience was for over 600 African-American males in America. But, I would actually challenge us to think that we don't have to go that far back. We probably can look, right? I mean, even in the early 2000s, Congress actually commissioned the Sullivan Commission to look at the unequal treatment, right? Or at least whether there was unequal treatment in our U.S. health systems. And they found that certainly BIPOC communities by far were experiencing disparities. And it had nothing to do, right? I mean, when you looked at individuals in the same socioeconomic status, living in the same communities, right, having the same access, they certainly they were BIPOC. So just based on race, ethnicity alone, they were certainly getting a lesser treatment or lesser access to medications or to care in general. And then about 5 or 6 years later, they conducted another investigation to see whether that commission and certainly some of the strategies that they they packaged under that unequal treatment study and book, whether they were actually whether they made any grounds, whether they were able to close those gaps. And quite frankly, it was startling to see that, unfortunately, those gaps had widened even more than when the original study was actually conducted. And so, my point here is that when you look, right, at what has happened, and certainly I would frame it from a triple crisis, right? Not only the pandemic, certainly the social unrest, but also the economic impact of this particular pandemic as well. Unfortunately, BIPOC communities by far have been left behind, right? They have been actually severely impacted and affected. Actually, the disparate impact in our BIPOC communities is pretty palpable. And so I would offer that as certainly, I think, the business case for why we need to actually take a greater call to action as health and healthcare systems to really meet our community needs, right? Meet our communities where they're at and really understand and come with humility to really get what are the issues at hand, what can we do, but not from a prescriptive standpoint, but about, coming in and saying, what are the issues? What are some of the solutions that I know you guys already have co-created, right? That we need to actually employ, and what else can we do? And I think that when we address the conversation in that manner, then we're going to be able to actually start having some impact. And I think building the trust that is required to move forward with some actionable steps on addressing this particular crisis.
Thank you. Dr. Benjamin.
There's a lot of good news. Okay. There is a lot of good news. And I would say that the issue around hesitancy is real. But guess what we're doing this evening? We're talking about the issues. There are people of color on this call that are talking about the issues. It's been a long time since Tuskegee. This vaccine is safe, and it's safe because thanks to years and decades of research, we were able to identify how people get COVID. And it's just absolutely remarkable that in less than 1 year, we have tens of millions, if not hundreds of millions of vaccines that are available. So one of the issues was, my God, this happened too fast. And I would say that is just amazing. We are living in the United States, but let's remember, there are people in other parts of the world, they don't even have access to the vaccine. We have seen the consequences of the absence of a vaccine, particularly in BIPOC communities, because we were essential workers. We had to get on buses. We had to be interacting with people, be in the grocery stores and everything else. So now that the vaccine is available, it saves lives. And I think you're going to hear a little bit more from Paula about the relief that it will save lives. One final point that I will make while preparing for these remarks, I just heard a story, and maybe Erica, you know the details here in Milwaukee, but in the state of Mississippi, African Americans are about 37%. And what the executive director, for the state of Mississippi said that just last week, the uptake of vaccines in the state of Mississippi was about 39%. So so in other words, you're now having uptake of vaccinations at the same rate as it is for the population. That's wonderful news. So let's dispel the misinformation with good information. Let's preach the good news. And I'm beginning to sound like a pastor that is not even Sunday. But grandmas want to hug their grandkids. Great news today that the vaccine is effective, you see, up to the age of 12. And they're going to do trials that are going to take it down all the way to 6 months. So we have a really amazing medical miracle, and it's so important. Final point. So one of my kids, a son, he is a pulmonary critical care doc. In other words, you come into the hospital, you may do well with your COVID, but then you have to end up in the ICU, and he is the person who is he helps to basically care for those patients. He says, think about the vaccine as a shield and not a sword. It's a layer of protection, okay? And it's there, it's available. Our country has made substantial resources. It's free of charge. And then I'm going to come back and I'm going to make a final pitch when we have a chance to go around. So that's what I have for you now, Tammy.
You are getting ahead of me, Dr. Benjamin. We're going to slide into it a little bit.
He made me want to say amen, Doc.
Well, Paula, why don't you pick it up from there?
Well, I think Andres and the good doctor both made really good points. A couple of things that came to mind listening to them. People always refer to Tuskegee when they talk about African Americans and our hesitancy toward the profession, the medical profession, and self-care. Bad things were happening to African Americans and other groups in this country long before Tuskegee, and have been happening since Tuskegee. It really hasn't stopped. I mean, just in recent years, Johns Hopkins was still doing naughty things. So I understand that history. It certainly does give one pause. But and the other point that the doctor made was that contributes, I think, though, to some of the concern is that the vaccine was created so quickly. And then you hear people, the docs and all the experts talk about how this is amazing. It usually takes 8 to 10 years to develop a vaccine, take it through testing and all that. So that hasn't really helped, quite frankly. But I think that from my perspective, I just feel that if we can, those of us who have had the vaccine and can, show that we're still here, it didn't hurt us, that there are some mild side effects. I don't think we should keep that from people, but they are mild, and the side effects won't kill you the way the full-blown virus will. So I think those are important messages. And I think also the thing that stands out for me, when this first happened, the largest number of early victims, and Doc, I would expect you to correct me if I'm wrong, but it was a large proportion of people of color that were infected, that got really sick, that died. And it left other people feeling like, well, this is something that's affecting those people. It doesn't impact me. Mm-hmm. And that's a situation where it's just a perfect illustration of how irrational racism is. Mm-hmm. Because, we've lost over 500,000 people now. Mm-hmm. Not all those people are Black and brown people. Mm-hmm. So it took all those deaths for so many people to recognize this virus does not discriminate. We do, but the virus does not. Mm. So, when I think about that, how many people of all groups died because they thought this was something that we disposables were only affected by? Mm. So I'm a big proponent of the vaccine. I have told people I'd put a sandwich board on and roller skate on the street to direct people to Erica's shop, to any place else, and say, you need to go and talk to Erica about this. She'll tell you the truth. Because I don't want to see any more of us die. I don't want to hear about it. It's heartbreaking. Mm-hmm. But I do think we have seen how racism plays out today in this country. That when people feel like, oh, it's just those people, they don't get serious about it until it affects all people. Then it's, oh my God, we got to do something.
Right.
So.
Thank you, Paula. And Erica, I know you want to pick up right there.
I do. I really do. So this is interesting to me because we stood up a 4-car tent on Port Washington Road to do testing. And we did that along with partnership between North Shore Health Department, because my clinic is in Glendale, and with Wisconsin DHS. And it was very interesting when we first set up, when people came through the tent, they were of all races. They were of all backgrounds. They were, and that was the best illustration of what you just said, Paula. It affected everyone. We had 3-month-old that were positive. We had a 105-year-old that was positive. We had people of all races, genders, socioeconomic statuses, people losing jobs, everybody. And to your point, everybody started moving and throwing money at everything that needed to happen. And that's why the vaccine was created so fast. When you have, and this is what this, I will always hold on to this. I will always hold on to this. If you have all the resources that you need to get the job done, if you know what the job is, scientists at NIH, they know what they're doing. They know what needs to happen. If they had all the money in the world, which they all of a sudden did when COVID hit, of course it's ready to roll. Of course it's going to happen faster. Everybody worked together, collaboratively, intentionally, and it's laser focused on getting that vaccine done. Of course it came through faster. Now, how can we make sure we transfer that energy, those resources, those attitudes to everywhere else and everything else we do from this time forward? Give us the money to do the things that we need to do. Those of us that have been doing it and know how to do it and do it well we can blow it out of the park. We can just do that, but that's what it takes to do it. And I hope philanthropists are listening. I hope government agencies are listening, other organizations, decision makers with funding. This is what we need to do this work and do it well. We know what we're doing. We know community. We know our community. We know what works and what doesn't work. But just because we say community doesn't mean it's free. And you pay for a consultant? We are consultants. And so we should never ask us, that's disrespectful. I have to say that out loud. That's disrespectful to ever ask us to do anything on behalf of our community for free. So in that, and during the pandemic, I have to admit, many a time I did a lot of free. But I did free because I lead with my heart. And I know it needed to happen. And I knew I had what was needed for it to happen. So I did it. And that's just how it goes. And the rest will figure itself out. But in the meantime, this is just amazing for us to be able to have this platform. And again, I can't thank Milwaukee Repertory Theater enough for this platform, because this is a part of that movable middle is what they call it. That people that just have questions, they need somebody to dialogue with and just answer these questions, and they'll say, oh, okay. And then, where's the vaccine? And that's why we set up vaccine clinics ourselves as a clinic. We want to be able to test people and give them that resource. And it's still free until through June at this point. But, I'll figure something out, because that's what I do. And we will make sure that people have access to that. But when it comes to the vaccine, I want people to know the vaccine itself is free. Make sure you get it. Do not hesitate about that. You see a clinic and you can go. We will be sending out text messages. There's all kind of resources. But how many times have I heard people say, I can't find an appointment? A million times. And it's a lot of reasons why people can't, because there's people sign up in multiple places simultaneously. And they're like, well, whichever the first one comes through, I'll get it. And that leaves people who are vulnerable populations that may not have access to internet, like at that level, have time to sit on the phone all day and get an appointment, then that leaves them out there. So that's why some of the clinics that I'm doing, we're not even putting them out there. We're targeting them intentionally to the people that really need it. So you'll see some more of us working with churches and such, doing canvassing, similar to the Get Out the Vote kind of model. And we'll be making sure that people that really need this get it.
So Erica, I want to transition us a little bit into this question around the systemic challenges.
Yes.
And what do we do beyond? So you all have lifted a number of concerns that contribute to why there's hesitancy. So there may be a lack of information. There may be historical trauma, Paula, as you've lifted, as so many of you have talked about in your responses. So can we talk about some of the systemic challenges and barriers that exist as to why vaccinations are maybe not widely available, or why people are not necessarily taking advantage of it, but more around the systemic challenges?
Yeah, let me just pick up to that excellent point question, Tammy, with where Erica just left off, because I really think that she really captures. It is really important that folks listen up. I'm a cardiologist. Take a condition like high blood pressure. Okay, we got lots of medicines to treat high blood pressure, but half of all people who have high blood pressure are not controlled. Let me just be sure that I get it across. That is a systemic problem. Okay, that's an example where you have to really now meet people where they are so that they can really, you can understand their issues, you can understand something about the medications. There are a number of barriers as to why people are not taking. So when they leave my office after I write the prescription, that's only the beginning. Okay, it's not the end. And so Erica's point about vaccination here is a fantastic example where she is in the community, where she is talking with folks, where that trust, that engagement is so powerful. And I'm just going to use vaccination as one example because prior to COVID, when you look at vaccination rates in BIPOC communities, it's consistently lower than other communities. So let's build on what we're doing now. And then let's extend it once we get beyond the vaccinations and recognize that the reasons why BIPOC communities had higher fatality rates are all of those comorbidities. Andreas mentioned about the asthma, the chronic obstructive pulmonary disease, the diabetes, the hypertension. I think we can begin to start leveraging lessons learned, okay? Because we are going to be successful in this particular situation and then really be able to build the infrastructure within communities to basically go not only to good health, but well-being. Because that's really what we want in communities. We want well-being. And this is so incredibly important. So my hats off to all the panelists, but Erica, you're doing the Lord's work, as they say.
And I thank you, Dr. Benjamin, and just talking about and echoing, I think, Erica, what you certainly have lifted around the challenges. And I'd love for anybody else to weigh in on challenges, but I'd like to move us to the opportunities around this. Dr. Benjamin, you started off talking about the good news. And I am one of those folks who may be listening that is on the fence, trying to figure out this piece around whether or not I should be vaccinated, and acknowledging that there's certainly been barriers, there's certainly been concerns that have been lifted in this conversation that have impacted my view. But I also am, in this conversation with a number of credible people that I trust, who are helping me to see it differently. But again, I want to give opportunity to kind of talk about additional barriers or challenges, but the opportunities that await us.
Yep.
Go
ahead, Paula.
Well, just one thing that I like so much about what Erica talked about is we cannot overstate the importance of the messenger in delivering the message. I'm dating myself, but I grew up when vaccinations were mandatory. And I grew up in a segregated environment, but the Black health professionals, the number of which I could count on one hand, they made sure that they went door to door for any children that weren't at school when we were herded through like cattle to get our smallpox and polio vaccinations. And if a young person wasn't at school the day that the shots were given, or we ate the sugar cubes, they went out into the community and took the vaccine to people. So I can't overstate the importance of the who delivers the message. and the credibility that you have. Now, ideally, we should all feel comfortable in knowing
Maybe Andreas
that.
can talk a little bit about.
I'm sorry, but anyway,
I was going to mention maybe.
Yes, Andreas can speak to that, because that was the point I wanted to make, that I don't think we can overstate the importance of the messenger.
Yeah, let me
particularly with FQHCs, maybe Andreas and how Frederick and others in that space.
Let me amplify that point, because actually Paula was part of a catalytic discussion that we had as what we're calling it now, or labeling it, community conversations. And these are actually our conversations that Frederick Health has been having on an ongoing basis with BIPOC communities. And it started actually with Eric Conley, who's the president of our academic medical center, an African-American leader within the organization. And it was actually his way, as we hit the pandemic, right? And as a new leader, even though he's not that new any longer, but fairly new to the community, to really continue to build that network, build that trust, have very candid and transparent conversations, authentic conversations, as he likes to label them, with our BIPOC communities. And during those listening sessions, similarly, Tammy, to what you described, that the Milwaukee rep hosted with our BIPOC communities, we learned a number of things. And one of the key things that we learned is that if we wanted to move the dial in terms of this particular pandemic, and actually I think it applies for any other issue, quite frankly, when we're actually reaching out to our community, was a couple of things. Number one, you have to have a trusted messenger who's delivering those key nuggets, right? Number two, you have to come into our community with a lot of humility. You cannot come in with a prescriptive approach or arrogance, as oftentimes it happens. If you also come into the community, make sure that you delineate what that engagement will be. And if you promise that you're going to deliver something, make sure that you follow through in your commitments. And so these were key messages that we heard. And so out of those discussions, thematically, having that key messenger, but also those key messages that were important, which were, and I think Dr. Benjamin mentioned that, is that the vaccine, we need to actually go out to the community and let the community know that, hey, this vaccine is safe, it's effective, and for some of our BIPOC communities as well, because of their undocumented status, that it's actually free of charge. Mm-hmm. And so when we were able to actually then listen to those key messages and then take them on and really understand what that really meant, that really then became catalytic for us. And so out of that is that we created 2 PSAs, one for the African American community that actually G. Smith from G. Clippers was the spokesperson. And now we have one that actually, as of today, we received the final version of it for our Latinx community, where Ricardo Diaz, who's the former executive director of the United Community Center, he became the spokesperson. And again, we decided that, you know what? Yeah, we might actually have the wherewithal, right? We have the competence. We are qualified. But at the end of the day, what good is it if we try to do it on our own rather than empowering and leveraging those spokespersons, right? Those messengers that are going to be able to drive those messages into the community, have authentic conversations, be trusted because they are part of our community. And so that was something that we learned. And I will tell you, we're looking right now at those metrics, both internally and externally, because we did this also with our business resource groups, and especially our African American Black BRG and also the Latinx, to make sure that we're also delivering and having these crucial conversations in town hall forums, where we invited our enterprise-wide chief medical officer, Dr. Truitt, to have a discussion with our BRGs so we could actually then dispel some myth, have an authentic conversation, understand why the hesitancy exists. And then out of that is that we're able then to move it into a vaccine confidence conversation and outcome. And I think that becomes critical when we are actually talking about vaccination and really looking at how to deliver those messages, and then looking right also about equitable vaccine distribution in our communities, which that's another whole issue that hopefully we'll have a chance to address as well here today.
Absolutely. Thank you, Andres. And I think I would love for us to stay there a little bit. You started to lift how important credible messengers are, how important key messaging and good talking points. And I would love for us to just, if we could popcorn and say, what are the critical messages that people who have hesitancy, who are exploring whether or not this is something that they will do for themselves, what are some of those critical key messages? And Eric, I'll start with you. If you can just quickly share what those messages would be.
Sure. One of the ones that I do tell people is that, again, in the name of being honest, you can still get COVID, even if you're vaccinated. But what it does do is if you're vaccinated, it does decrease the severity of your illness. It decreases hospitalizations and it decreases death. So you have, it gives you a chance. It gives you a major chance. So that's one thing that I say. I say more, but I'll let others go.
Thank you. Paula, key messages.
You get the vaccine, you can prevent your loved ones by your example from contracting the virus. So if you get it, you go and tell everybody, I got it. It's okay. I'm gonna protect you from me now because I could still be exposed and give it to you. But just let your family members know that if you get it, then it's good for them to get it, and really encourage them. Don't beat up on them about it, but really encourage them to do it. Mm-hmm. And I think Erica made a real good point, but it's not any different than the flu shot. You get the flu shot, you can still catch the flu, but it's not as severe. So that would be how I would piggyback on what Erica shared.
All right. Dr. Benjamin, key messages.
You bet. So I'm going to be very imaginative by simply answering Paula's question. And Paula said that, can you say something about the fear people have of catching the virus from the vaccine? How the COVID vaccine doesn't have the live virus. So this is now about the messaging. Think of mRNA as a form of genetic material. But what's really exciting and really what happened was that this messenger material, once injected into the body, is going to form a part of the virus. You're not getting a live virus. You're getting a virus that's called a spike protein. Any virus has to attach to a cell. And so what happens is that you're going to make a protein, the body will recognize that protein as being foreign, and it's going to mount an immune response, okay? And that immune response is stored in the form of antibodies as well as cells. That's how you gain the protection. You're not getting a live virus. You're getting a portion of the virus. It's impossible for you to basically get a live virus from the vaccine. But just remember, as Erica said, this is more a shield. You could probably still get one of the variants. So we will probably still be continuing on to wear our masks. Everybody wants to get back to normal. I don't know exactly what normal might look like as yet, but certainly you might be able to get on that airplane. You might be able to, especially with family members who are also vaccinated, the CDC has indicated those things are okay to do. You'll be able to go back to work and you'll be able to relieve yourself of being on all those constant Zoom calls. Not this one, of course, but the others. And then the final point is, are you likely to get a booster? And it's likely that that's something that obviously Dr. Fauci and others are going to advise us on at some future time, because we know that, again, these variants are occurring, and the more of us who actually take the vaccine, we reduce the likelihood of having variants.
Mm. That's some of the good news, Dr. Benjamin.
I'm here to share.
Well, I'm going to ask you to stay off mute. I'm going to take a couple questions from our viewers. One of the questions that we have is around safety. So just some of the conversation we're having, and that is for women who are breastfeeding, is it safe for them? Is it safe for the baby?
Erica, did you want to do that first? I actually did look up a few things, but your voice might actually be.
Wow, now that coming from the good doctor, okay. Wow. So yes, it is safe. It's safe for women that are pregnant, and there's no indication that it negatively impacts the babies. So it is something that is very, very important, especially for pregnant women. My sister's a doula, so I'm very much involved with my practice with mothers that are babies, and I'm actually a consultant to the donors, the doulas of North America. So you're good. You're really good.
Shout out to the
It's called Zoom chemistry.
I got you. I got you. Thank you for that.
All right. So we have another question to whichever panelist wants to respond, but concerns about the rise in COVID cases that may trigger a lockdown. Someone alluded to France. So anybody want to tackle that question about a potential lockdown again?
You know, some of the experts are really concerned about that. And I think perhaps the most vociferous is the CDC director, Dr. Kulinski. And the reason is because we have been able to have tremendous success. I don't think I'm violating anything, but the numbers are very low that are in our intensive care unit, and they're even lower in our hospital. And that's good news. And as Andres will tell you, we are one of the largest, not only academic medical centers, but health systems in the state. So that's the good news. At the same time, we know that there are variants, be it from South Africa, Brazil, the UK, that are still in our communities. And as we have, and I didn't want to get into the politics of this, but again, I think that the CDC has recommended that we continue to keep safe distances, wash our hands, get the vaccine, wear a face mask. If we do all those things, even in the presence of additional variants, we might be able to avoid the fourth wave. We've had 3 waves. We know what they look like. Let's basically all work together to basically win that. And of course, go Packers.
Erica, I'm going to pose this one to you, but I think, Andres, this may be a potential question, and it has to do with stimulus dollars being disseminated to organizations like yours, Erica, Health Connections. So the question is, will stimulus dollars being given to organizations who work with the community, will there be access to that as new stimulus dollars come to do some of the vaccination work?
Yeah. So I've been told, not directly though, that is the goal of the funds, of some of the funds. We are definitely in need of those funds so that we can continue to expand and expound on what we've already started. I actually belong to probably about 5 different community organizations and groups and collectives where we are we're working with grassroots organizations, community organizers, faith-based and a lot of church organizations, and we just happen to just run in a lot of different circles where if we got stimulus dollars, like I said before, if we had enough money to do the things that we know to do, and this could just be amazingly, incredibly just important for the community, period. Definitely from a COVID vaccination and protection and testing access standpoint, but really, really from a space of people feeling like they're not getting left out. They're not getting left behind. I have had that conversation with many leaders in the community who felt, well, why didn't they call me? Why didn't I get the vaccine? Why can't? And I said, you know what? Let's you and I work it out. And we setting dates, we're setting calendars, we're making it happen because we're a vaccinator ourselves. And that's why I signed up for us to be vaccinators, so that we can remove those barriers. But I just know, this is just how, we use what we have to get what we need to get done. However, we are sorely undersourced and under-resourced compared to other organizations and in order to get this done. But we do what we have to do with what we have. And that's all we can do. But we would love to be, and we're always open for partnership, to make things happen in ways that if people can't get to community and they come through us, we will get you to community. Because if you have the resources and we have the access to the people, please work with us. We'll make it happen.
Andres, any?
Yeah, I just will say very quickly, because I want to be mindful of time here, maybe get one more question. So Eric is absolutely right. I will tell you, wearing a different hat, I serve on the board of 16th Street, which is a gem in our Latinx community. And that's the discussion that we're having a week ago today in our board meeting in terms of those dollars and how that will be a booster strategy, especially in the Latinx community that it became, unfortunately, right after the devastation in the African American community, we became the new phase of COVID, and we continue to struggle with that. And certainly 16th Street, as well as Erica's and her organization, and all the other federally qualified health centers, they're advocating for not only the dollars, right, those resources, but also in terms of getting equitable distribution of those vaccines into our community. That is imperative. We need to make sure that they get it, alongside with all of our health systems, because this is one where we have to join forces. This is not about just one part of the formula. This is everyone, all hands on deck. As I like to say, we all have a vested interest in making sure that we're all joining forces here and making sure that we're all doing and contributing to certainly addressing this particular pandemic. So the answer is yes. And so we're hopeful that we'll get some of those dollars and then also the vaccines to make a difference in our Latinx community.
Fantastic. I want us to tackle one final question from our chat, which is around how do we get the message out and reach Gen Zs, and millennials about the importance of this vaccination. So I'm going to ask you if there's a couple who want to respond in 30 seconds or less, and then we're going to do final wrap up closing remarks by each of our panelists. But how are we reaching youth and young people around these vaccinations? What's the strategy and approach? Put on your PR hat, people.
Yeah.
Well, I would say, as the mother of a millennial, they respond best to their own messengers, based on my experience. If they're in a group of their own, and somebody, fortunately, my millennial, just by her work, got the vaccine pretty early on. She is the one that can influence her peers of the importance of doing it. They don't necessarily want to hear from all us old heads about what they should be doing. So I think for those who've had it, either because of their professional affiliations or whatever, they are the messengers you want to look for to help bring that message.
Great. Thank you, panelists. I want to give you an opportunity to talk to the people out there like me who may have started this conversation very much so on the fence. Maybe we're leaning towards making the decision, but give me your best case forward for why Tammy and others that are part of the BIPOC community, as well as other communities, should really make a decision about vaccinations. And Erica, I see you smiling, ready to go. So I'm going to if you can do it in a short order, please.
Thank you. This is one tool. The vaccine is one major tool for us to get out of this pandemic and get out of it safely and get it out of it with everybody that's here in our families, the way to protect our family, ourselves, our community. And one thing that as of late that has come up is an important point, kind of addressing Paula, definitely listening to people that are your peers, but also travel. it's going to be required at some point. You might as well go ahead and get it done. Don't miss that plane ticket.
That's true. I can say ditto, Erica, on that. I think the thing to think about, and what I think has been good about the traffic on the vaccine right now, is that it has made us explore other health issues. And I think that's a good thing. So people who are thinking about whether or not to get the vaccine, I think they will get vital health information associated with that simple act that can help, lead to better health outcomes in general. So my encouragement would be learn more about it, the pros and cons or whatever. Think about your own personal health and what your challenges might be, and weigh the pros and cons as it relates to that, and go to people that you trust and talk to them about it. But I'm a big proponent. I say go vaccine.
Okay. Team vaccine is for Paula.
That's right.
Assume hashtag team vaccine for everybody on the call. Yeah,
definitely.
Andres?
I will echo the comments made by Eric and Paula. And again, I'm going to go back to the comment that I made earlier. This is really about ensuring, again, we're giving you here information ultimately, right? You have to trust those sources in your community, right? Messengers, maybe your primary care provider, if you have one, someone, right? I mean, you heard a number of us here have been vaccinated. Did we experience maybe some discomfort, some certainly symptoms? We did, but we're still here. And we have that shield that Erica talked about. And so I'm going to go back to the point about it's effective, it's safe, it's free to all. Make sure that, again, you make the best decision for you and your family. And I think ultimately we're all trying to inch, right, that this summer, maybe as the president said, right, in his inaugural speech, maybe by the 4th of July, we can have a small barbecue with some of the loved ones that Dr. Benjamin mentioned, right, that they may be vaccinated as well. So think about a little bit of that new normalcy and the fact that we're seeing a little bit of that light at the end of the tunnel. So I would say absolutely consider it. And again, I am for the vaccine, and I think it's important for you to make that decision for you and your family.
Thank you, Andres. Dr. Benjamin, bring us on home with the good news.
I'm going to work on it. So the good news is about credible messengers. One of the distinct pleasures I had was to invite my daughter, who got her MPH and is a first-year medical student, and probably falls within the age group. So I would say that not all information that's out there is the best information, but what I would say, credible messengers, nursing students, pharmacy students, medical students, they're all members of the BIPOC community. And if they're your friends or your cousins, you need to get in touch with them. Okay, so Tammy, let me talk to you tonight. Okay. So if anyone is listening up tonight, you got to do something tonight. You got to call somebody that you know has got some hesitancy. And you need to talk to them and speak with them, but meet them where they are. That is probably the most important thing. So, Tammy, I'm appealing to you through, of course, this amazing job that you have done. But for everyone else out there, call up your family member, call up your friend, take your girlfriend and say, girl, we're going to go get that vaccine. I'm going to even help you find out how to get to Erica. So we're going to be able to do this as a community because it's so important for all of us. This is not a one-person sport. This is a community sport. Our communities are going to be healthier. Our entire families are going to be healthier. We're going to get through this together. And once again, my sincere thanks and appreciation for everything that I've learned from this esteemed panel this evening, and to you, Tammy, on what the Milwaukee Rep has done in bringing together all of us, not only to talk vaccinations, but to get our shots and put a moonshot.
Thank you, Dr. Benjamin. Thank you to all of our panelists tonight. Thank you for sharing the good news. To my Milwaukee Rep family, appreciation for the opportunity to have these important conversations. This is an extension of our work, our collective work together. I am closer and closer to making good decisions. I am not going to make my announcement tonight, Dr. Benjamin. However, I am committed to continuing the conversation because it is important, and the health and well-being of our community is critical. So again, to all of you who have joined us this evening, to all of our audiences, we appreciate you. We thank you for your continued support and participation, I should say. And for more information on Milwaukee Rep, we encourage you to visit us at milwaukeerep.com. Enjoy the rest of your evening. I hope that this has been an important conversation for you as you're making decisions about being vaccinated and well. Good evening, everyone.